Hi, my name is Lola Loeb. I am a general OBGYN in Hanford, California, which of course nobody knows where that is. That's 30 miles south of Fresno,
Okay.
about 3 hours north of Los Angeles.
Okay.
Uh,
Cool. So, Dr. Loeb, we are talking about your mother's health, your aunt's health, grandma's health, your auntie's health. So, are there certain things that women should do between certain ages, just generally, in order to stay healthy?
um, Clearly, diet and exercise is
Mm-hmm.
number one. Maintaining a healthy diet is good for the vagina. One of the things I find a lot, I see a lot of women with diabetes. And sometimes the way I discover or I find out that they have diabetes is because they have recurrent yeast infections.
Hmm.
And I tell my patients, the one thing that yeast needs to grow is sugar
Hmm.
in a dark place, right? When
Mm-hmm.
you make alcohol, right, it's usually from fruit that's really sweet, and you put it in a
Mm-hmm.
dark place,
Mm-hmm.
and the sugar ferments, and the alcohol is made. Well, yeast is sort of the same way. It's in a dark place. It has lots of sugar. So among the myriad of bacteria that lives in the vagina normally, that normally shares the same food source, when you have an overabundant amount of sugar in your bloodstream, that provides an abundant food source for yeast, and the yeast will overgrow.
Mm.
So that's one way that diet can impact your vaginal health. Another thing is in the case of infertility. So we know now from the studies in bariatric surgery that women who are overweight that lose weight through bariatric surgery improves their fertility. Weight loss through bariatric
Wow.
improves their fertility.
Okay.
So diet can improve your fertility, which impacts your health as a woman. Even older for older women who are menopausal, diet can impact your the effect on hot flashes. There are some foods that are high in soy, like yams or sweet potatoes, or there's a soy spaghetti out there now that will increase natural estrogens and it help in some cases improve hot flashes. So
Mm.
probably diet and exercise are the number one, I would say the number one things that women should work on to improve um, their,
Their overall health.
yeah,
Yeah.
their gynecologic health.
Mhm. You spoke briefly about menopause. I'm at the age now where a lot of my female friends are going through this process of menopause. What can help ease some of the symptoms of menopause, the hot flashes and everything else?
So some of the major symptoms that people complain about with menopause is hot flashes, mood swings,
Mm-hmm.
sometimes night sweats, um, vaginal dryness, difficulty with sex. I actually get that question quite a bit, mainly because women say, "Well, I didn't feel comfortable talking about this with my doctor, but you're a woman, so I'll talk with you about it."
Mm-hmm.
And there is an increase in the feelings of not wanting to have sex, or because they have the vaginal dryness, sex is more painful,
Mm-hmm.
and so they tend to avoid it. So one of the things, besides having the extra estrogen in your diet, the other thing is that you might want to increase foreplay. When you're older, you don't have as much estrogen. It may take longer for you to get moisture, and therefore you may have to increase the amount of time you spend at that stage of intercourse. The second thing is there are lubricants out there that will work. The KY Yours and Mine people tend to like quite a bit, and there's also some vaginal lubricants that we can prescribe that will help in that arena.
Mm-hmm.
The other thing that will help in menopause is sleep hygiene. which gynecologists don't talk about much, but if you talk to the internal medicine, sleep hygiene will improve your overall health. And that means go to bed without the TV. Turn the light off, turn the TV off. If you still cannot sleep, get up, do something different for about 15 minutes and come back and try it again. I'm not such a proponent of medications for sleep because some medications do have a rebound insomnia associated with them. So you take them for a few nights, you fall asleep, and then you'll find out over time you can't sleep because now they're causing you to stay more awake and they're more alerting. So I tend to sleep hygiene. There are some natural oils out there that do help with sleep. One that I tend to use is called vetiver. It works. You don't get the groggy after effects with it, and you'll get a good night's sleep and wake up refreshed. So that's very helpful. And then recognize mood swings for what they are, so that you don't abuse your family.
I know what you mean.
So, and sometimes there are medications to help with that. Also, some of the antidepressant medications will help with your mood swings as well as improve your hot flashes. Okay. So I think that's important. And I think it's important for us to be okay with using antidepressant medications because sometimes we need them, especially as African Americans. You know, we want to go to church to help with our depression, and that's not bad. You know, we all have a prayer life, but sometimes we have to recognize that God gave us this knowledge for a reason, and we should use it to help our lives get better. So that would help with your moods, that'll help with your hot flashes, and your family will love you for it too.
Okay.
So,
well, you also opened the door, so I'm just going to walk right in there and talk about BV, bacterial vaginosis.
Very important. And I don't think there's necessarily a racial component to BV, but I think it's very prevalent, and I think we miss it a lot of the times as OBGYNs, especially during prenatal care, because there are a goodly number of OBGYNs who, when they check a urine, they only check the glucose and the protein. And if those are normal, you're good. But a lot of times the white blood cells tend to show up, and they kind of give us a clue that there's something going on in the vaginal flora that's not normal. And that gives us an opportunity to test and then treat. The other thing is an increased vaginal discharge with an odor. And the odor, to make it understandable, is like stale corn chips. And sometimes people around you can smell it, and sometimes they can't, but you can always smell it. So if you have an odor that's like a stale corn chips and you have discharge, go to your doctor. Most likely they'll prescribe a medication for you. That same medication is safe in pregnancy, and we know that BV can be the cause of preterm labor or premature rupture of membranes in some cases. So it needs to be treated. We probably should look for it more often. But at least if you know about it, you know to ask about it, and that's the most important thing.
Good. Real quick, just about bladder leakage. We're hearing more women talk about bladder leakage as they age.
It's a very embarrassing subject. And I have quite a few women, even myself my thinking was off because I thought this is an old woman's disease. And I'm not going to see patients who have bladder leakage till they're in their 50s and 60s. They've had a lot of babies. They're overweight, and the increase in abdominal pressure presses down against the bladder. And so the muscle that holds the urethra closed weakens. And so when you cough, normally that muscle closes and it keeps the urine in. However, once you get older and there's been a lot of trauma to the bladder or to the bladder area when you carry a number of babies, that muscle weakens. So then when you cough, it doesn't close, stays open a little bit, and a little urine comes out. There are various treatments for that. I usually start off with the least invasive, and that's called Kegel exercises, where you squeeze those muscles, you hold them closed for 10 seconds, and then you relax. And that's something you can do while you're watching TV, while you're sitting in the car, while you're doing laundry. You practice squeezing those muscles for 10 seconds and relax. That helps. Sometimes if you're older and you're of the menopause age, a little estrogen cream in the vagina will help. There are non-invasive, which is the Kegels. There's another non-invasive method of treatment, which is called a small rubber ring called a pessary. And that I've been using quite a bit lately because now I have patients who have the problem. They either don't want surgery or they're not candidates for surgery. If you don't want surgery, then there's an option, and that's to use a small vaginal ring. We come in, we measure you, we fit it to your size, and it holds the bladder up to prevent the leakage. So that's an option that I've been using quite a bit here lately. And of course, there's the surgical options where you can support the bladder neck with a small piece of mesh. And this is not the mesh they're talking about where the company has been shut down basically for using the mesh to actually put in the bladder or lift up the bladder. This is just a small piece that goes under the neck of the bladder just to support it so that, again, when that cough happens, that muscle is tightened around the neck of the bladder. And then there's a surgery where you put the bladder back in place. So, but for women who are not candidates for that, I either use Kegel exercises. You can use medication to help with bladder leakage because there's a myriad of medications that are out now that are good for supportive bladder leakage. But for those women who aren't willing to take more medications, and of course, the older you get, the more medicines you're on. So a lot of women are like, please, Lord, not another pill. So then I offer Kegels or I offer the pessary to put in place.
Awesome.
And the other thing about that, let me just say really quickly, is that we shouldn't leave young women out because we have young women who are in their 20s and 30s that have had large kids, 8-9 pound kids, or women's in their 20s and 30s that are over 300 pounds. And for those women, while weight loss is best, they are still candidates for the pessary if they don't want surgery.
Okay. A couple more questions real quick. We receive a lot of questions about ovarian cysts and how those are affecting women nowadays. Can anything be done about it? What's going on with those?
So we have to think about cysts in terms of what's normal and natural and then what's abnormal.
Okay.
A lot of time women go to the ER for a myriad of reasons, and abdominal pain, back pain, and they get a CT scan. And the CT scan will show a cyst, and then the ER will send them back to me and say, hey, this lady has a cyst, can you see her? And the thing we have to think about is that in order to ovulate, you have to form a cyst. It's usually small. It's usually what they call functional. In order for the egg to come out of the ovary, it builds up fluid behind it. And that fluid, when you look at it, looks like a cyst, but it's not cancer. It's just a functional cyst. So sometimes you'll get a cyst and it'll change from ovary to ovary, and it's not bad. Sometimes the cyst can grow. It doesn't extrude an egg, and the fluid builds up even further, so it becomes larger. And then it'll rupture. That can cause pain. Anything that causes irritation of the peritoneum will cause pain. And so, again, that's not cancer, so we don't have to worry about it from that point of view. But, we do have to treat the pain. The other option to treat women who have multiple cysts is birth control pills. Birth control pills won't make you infertile. They won't give you breast cancer, but they can control cyst formation. And so that's always an option in younger women, even some older women, depending on their health status. If they have high blood pressure, they're still eligible for a pill, but it's just a progesterone-only pill instead of a combined estrogen and progesterone pill.
Got it. So, doctor, where can people find you?
I am, as I said, in Hanford, California. I work with the Adventist Health in Hanford. I have a small private office. It's called PNMG Women's Health. And online, I am Loeb@yahoo.com.
Okay.
And I don't have a website as of yet.
Hey, no problem.
We're working on that.
Hey, people
That's
can still
coming.
get in contact.
They can contact me at any
Yes.
time.
Yes.
Glad to answer questions.
Awesome. I know they're looking forward to that. So thank you, Dr. Loeb, for stopping by, taking time out. And we're right here at the NMA Conference 2018. Thanks again.
Thank